Good morning. I am Dr. Samantha Scott and I will be talking to you on first aid and wound care. What is first aid? The first and immediate assistance rendered to your pet. Sometimes it's the difference between life and death. Today we will focus on items needed in a first aid kit and initial wound care. In a subsequent episode, emergency care and stabilization will be discussed. Important information one should have in your first aid kit in the event of an emergency are important numbers, such as your veterinary clinic and the emergency veterinary clinic number for after hours. Also, your pet's medical record, especially if they have some pre-existing illness or anything that they are allergic to. Other general supplies, thermometer, muzzle. When your pet is painful, they tend to even bite their owners when they are handled or when trying to move them. Access to a leash and collar and/or carrier to handle and transport them to the vet. Items that you would need for wounds. Syringes of various sizes for irrigation of wounds and other uses. Saline solution, which is used for irrigation of the wound, which is washing away of visible and microscopic debris. This reduces the bacterial load in the tissue, which helps decrease wound complications and infections. If no saline, normal tap water can be used. Savlon or other antiseptics used to clean wounds to kill and prevent bacterial overgrowth. Hydrogen peroxide can be used as well, but diluted 1 part peroxide and 1 part water. It could be used initially, but not every day as it tends to slow down wound healing. After cleaning and drying the wound, an antibiotic can be applied. Gauze roll or cotton rolls for temporary bandage of wounds and stabilization of fractures for transportation to the vet. Clean towels can be used to apply pressure to bleeding wounds. Apply pressure for about 3 minutes, then check and see if the bleeding has stopped. The tapes are mainly for bandages, which are temporary until you get to a vet. Items needed for intoxication. When your curious pet ingests stuff that they are not supposed to, a list would be provided on an upcoming slide. Hydrogen peroxide is also used to induce vomiting and activated charcoal to absorb toxins. There are some commercial activated charcoal tablets. Before administering anything to your pet, please call your veterinarian. If only it was that simple. Here we have the syringes again. We would use them to syringe these items in our pet's mouths. It doesn't have a pleasant taste, so your pet would not be cooperative. Before administering anything to your pet, please consult with your veterinarian. I can't stress that enough. Here is the list of the toxic and safe foods for your pets. The main ones are chocolate, grapes, and raisins. In your first aid kit, some medications that come in handy, they are Benadryl or some other antihistamine for when those pets get themselves into trouble. Meloxicam, which is also good to have when the animal is painful or having a fever. It is safer than the normal human medications. Always consult before administering any medications to your pet. Next, we'll be looking at wound care. Can I treat my pet's wound at home? Factors to consider if the wound can be treated at home. The severity or extent of the wound. How bad is it? How old is the wound? Is it already healing? What caused the wound? Where is the wound located? Is it at a joint and there's constant movement, which would delay healing? Is my pet looking at it all day, also preventing healing? Types of wounds. Minor cuts, scratches, and abrasions can be treated at home. The wound is flushed with saline or tap water. The fur around the wound can be shaved if your pet allows. Then the wound is cleaned with an antiseptic, dried, and triple antibiotic cream or ointment applied daily. Deep puncture wounds need to be flushed with saline, cleaned with antiseptic, or even diluted hydrogen peroxide. These wounds have the potential to get infected and sometimes cause tetanus, which is life-threatening. Ideally, the animal should be seen by a vet and prescribed oral antibiotics. Animal bite wounds can be initially flushed and cleaned at home, but also should be seen by a vet, as these have the potential to get infected. It all depends on the severity of the wound. If it's a minor bite wound, it can be managed at home with daily cleaning and triple antibiotic ointment or cream applied. These wounds cannot be treated at home, and the animal should be taken to the vet as soon as possible. Severe wounds such as lacerations and chop wounds, the bleeding should be controlled first and the pet transported. Clean towels, gauze, and bandage material can be used to help stop the bleeding. Fractures could be stabilized with bandaging for transport and then the animal taken to the vet. Impalement wounds, the object should never be removed but should be immobilized. The animal should be kept calm as well and should not be able to move. A lot of padding should be used as seen in the picture. A muzzle can be used as the animal will be painful and may try to bite. The pet is then taken to the vet as soon as possible. Managing wounds and bandages at home. My pet returns home with sutures, bandages, a cone, a drain. Now what? What do I do? After taking your pet to the vet for severe wounds, they would return home with either sutures, surgical drains, or bandages. Sutures should not get wet, and the pet should not be allowed to lick at them. If licking, the pet would need the dreaded cone of shame. If there is oozing, the area around the sutures can be cleaned with a damp cloth or cotton. Reduce activity until suture removal, usually in 10 to 14 days. Surgical drains are placed to remove excess fluids from the wound to aid wound healing. The drain is sutured to the skin to keep in place. The fluid is usually light red in color. If it looks like pus, call your veterinarian. Your pet should not be licking or chewing at it. If they are, they cannot get away from their favorite cone. Fluid will be flowing from the drain, and that area below the drain should be cleaned daily or sometimes twice a day with diluted Savlon or even just soapy water. Make sure the sutures do not get wet. Reduce activity as well. Drains are usually moved in 3 to 5 days. You will get specific instructions for your pet before leaving the clinic. Bandages are applied for fractures or severe open wounds. The bandage must never get wet. If it does get wet, you need to take your pet to the clinic as soon as possible or remove the bandage. This leads to skin irritation, blistering, and then eventually infection. In severe cases, the limb will have to be amputated, so don't let the bandage get wet. Your pet should not be allowed to lick or chew at the bandage, or else you guessed it, the pet will need a cone. The activity of the animal should be restricted. Leash walks can be used to take the animal to urinate and to stool. If it's wet outside, a plastic bag can be used over the bandage. When the walk is finished, the plastic should be removed. Humidity will cause the bandage to get moist if the plastic covering is left on. The bandage should be checked twice daily for wetness and should be monitored if it is slipping. The tightness of the bandage can also be assessed. If the area above or below the bandage is swollen, red, or cold, the bandage might be too tight and your vet should be called. A too tight bandage can cause your pet to lose their limb. Check for foul smells or discharges from the bandage. If so, make an appointment to see your vet as soon as possible. The frequency of bandage changes are based on a case-by-case basis. If it is an open wound, the bandage would need to be changed frequently, every 3 to 5 days. For fractures, 10 to 14 days. Thank you for your attention. Any questions? They will be answered next week Tuesday. Stay tuned. This is just a list of some of the references used.